Can dental implants be safely done in under 5 minutes? Yes, they can. With the use of Dr. Nguyen's 5-minute implant technique, dental implants are placed using the high-tech equipment to aid the safest, most predictable, most accurate, and guaranteed implant placement. So here we're going to take a look at a 3D CAT scan, and the importance of the CAT scan is it gives us a three-dimensional view of the bone. So not only can we see the bone from side to side as we could in a conventional X-ray, we can see the bone from all 360 degrees. And the importance of this is it allows us to see how close we are to the bone. For example, here we've got almost 2 millimeters to the front of the bone. And we can also see things like sinuses and nerves, adjacent teeth roots, stuff like that. All super important. So once we figure out the ideal placement of the implant, we're not too close to the teeth next to it, and we're avoiding nerves and sinuses, then what we can do is we can take an additional piece of technology that we use and merge the two items together. And that second piece of technology is a 3D intra-oral scanner. And that gives us a definitive view of what's actually visible in the mouth. And that's what this yellow model outlines. So can it be done in 5 minutes? Let's see. So at this point, we're just now getting started. The patient's been numb for 10 or 15 minutes just to make sure that he's comfortable during the procedure. And essentially what we're doing is we're using a tissue punch, and it's going to make a perfect little hole in the gums. And we're going to do that a couple of times just to get all the way through the tissue. This is probably the most invasive part of the surgery. The best way that I like to explain it to patients is if you've ever bitten down on a chip and you kind of catch the corner or the sharp part of the chip on your gums, similar to that. There's not a ton of nerve ending in the bone, and so once we start actually placing the implant, that's not going to cause much pain or discomfort, I would say the following day or even the same day. So once a little piece of tissue is removed, which we'll get here in just a second, then we'll place the surgical guide back on and continue the implant process. Now that we've got the little piece of tissue taken out, which took us about a minute to do, we're ready to go ahead and put the surgical guide back on and move forward with the implant process. So at this time what we're doing is we're placing, we call this a reduction key. And a good analogy is if you're going to drill into a piece of wood, you don't necessarily want to start with the largest drill bit. You start with the small little hole and make your way out into the final size that you want. So effectively that's what we're doing here. This particular implant is 3.5 millimeters wide, which is on the smaller side of what we do for implants, but definitely sufficient for this tooth. And so with the 3.5 millimeter implant, the first hole that we just made was 2 millimeters wide. And so now we're going in with the full width drill, which that one's 3.5 millimeters wide. And we call this the osteotomy. This is the hole that the implant is going to go into. And depending on the length of the implant, sometimes we use 1 or 2 or possibly 3 or 4 different drills. Longer implants require a little bit more drilling, but the time difference is relatively negligible. And so here I believe this is the final drill. Alright, so at this time I'd like to go ahead and show you what the actual implant looks like. This is actually me holding a 3.5 by 10 millimeter long implant. And I like to show this, especially a nice close-up with my fingers, because it shows how small this is. A lot of people are thinking, oh, I've got this giant screw that's going to go in my mouth. No, it's literally 10 millimeters long. And at this point we are screwing the implant in. And now we're using a wrench to tighten it in. And as we come up on the 4-minute mark, we are wrapping up the implant. So as you can see, 4 to 5 minute implants is fairly realistic, but most importantly, I want to emphasize that we didn't start out with this concept by trying to do the fastest implant. We came up with this conclusion by trying to create the safest implant procedure. And as a result, we're able to do it quickly. But safety and accuracy is always of the utmost importance and takes precedent over time.